The title of this presentation is First Trimester Risk Assessment for Down Syndrome. Most pregnant women will have a healthy baby, but it is estimated that approximately 1 in 30 or 3% of babies will be born with a birth defect. Some birth defects are mild and others more severe. Therefore, there are a number of tests offered to pregnant women to identify a developing baby, also known as a fetus, with certain specific medical problems to be sure they get appropriate medical care. Down syndrome is a common condition for which prenatal care providers routinely offer testing. It is estimated that 1 in every 650 babies is born with Down syndrome. Each child with Down syndrome is unique and, like all children, have their own personality, strengths, and challenges. However, there are some characteristics and birth defects that occur more frequently in children with Down syndrome than in other children. These include low muscle tone, delayed development, mild to moderate intellectual disability, heart defects, characteristic facial features like upslanted eyes, and an increased chance for some medical problems like hearing loss and thyroid conditions. Chromosomes are packages of genetic information found in all of our body's cells. There are usually 46 chromosomes or 23 pairs of chromosomes in each cell. One member of each pair is inherited from the mother and the other from the father. People with Down syndrome have 3 copies of chromosome number 21 in each cell instead of 2. For more information about Down syndrome, contact the National Down Syndrome Society online at ndss.org or toll free at 1-800-221-4602. It is much more rare, but a baby can also be born with 3 copies of chromosome 13, resulting in a condition called trisomy 13, or 3 copies of chromosome 18, resulting in trisomy 18. Both trisomy 13 and trisomy 18 cause very severe medical problems, and most infants born with one of these conditions pass away before their first birthday. Since Down syndrome is a common condition that can occur in women of any age or race, all pregnant women should have the option of testing for that condition. Screening and diagnostic testing are available to meet the different needs of each woman. A screening test does not tell you whether or not you have a certain condition, but can tell you if your chances are higher than average. A diagnostic test, on the other hand, will tell you for certain whether a fetus has Down syndrome or any other condition with an abnormal number of chromosomes. Chromosome testing can be done between 10 and 13 weeks of pregnancy on a sample of cells taken from the edge of the placenta in a procedure called chorionic villi sampling, or CVS. After 16 weeks of pregnancy, a sample of fluid can be taken from the sac around the fetus in a procedure called amniocentesis. The amniotic fluid has cells from the pregnancy that can be used for chromosome testing. Both CVS and amniocentesis accurately determine whether or not a fetus has a chromosome difference. However, women who have either of these procedures have a small increase in the chance for pregnancy loss in the days after it is performed. The chance for a miscarriage after an amniocentesis is reported to be 1 in 300 to 500, which is similar to the rate of miscarriage after CVS when performed by experienced operators. Many women would like information about the likelihood for their baby to have Down syndrome before deciding whether to have an amniocentesis or CVS procedure. One way to assess a woman's chance to have a baby with Down syndrome is by looking at her age. The chance of having a baby with Down syndrome increases as a woman gets older, and women aged 35 or more are often considered to be of advanced maternal age. However, the number of women having babies over the age of 35 years is relatively small, and most babies with Down syndrome are born to women that are younger than 35 years old. That is why doctors today look at age in combination with other factors to give a more accurate assessment of a woman's chance to have a baby with Down syndrome. First trimester screening provides additional information about the chance for Down syndrome to pregnant women of all ages. This risk assessment helps some couples to decide whether or not to have a diagnostic test like CVS or amniocentesis. In first trimester screening, an ultrasound examination is done between 10 weeks 3 days and 13 weeks 6 days of pregnancy to determine the baby's length from the top of the head to the tip of the tailbone and to measure the nuchal translucency, also known as the NT. The nuchal translucency is a pocket of fluid at the back of the neck of the fetus. While the size of the nuchal translucency varies from pregnancy to pregnancy, babies with Down syndrome tend to have larger nuchal translucency measurements than those without the condition. It is crucial for the nuchal translucency to be measured properly so that the chance for Down syndrome is not over or underestimated. Therefore, the Nuchal Translucency Quality Review Program, the NTQR, offers training and credentialing for sonographers and physicians to assure that accurate measurements are used in Down syndrome risk assessments. To find a credentialed provider in your area, talk to your doctor or midwife or go to the NTQR website at www.ntqr.org. First trimester screening also requires a sample of maternal blood to determine the levels of PAP-A and HCG present. The amount of PAP-A is usually decreased in women carrying a baby with Down syndrome, and the amount of HCG is increased when compared to the expected amounts in women whose babies have the usual number of chromosomes. The nuchal translucency measurement and PAP-A and HCG levels are combined with the mother's age to calculate the chances for the fetus to have Down syndrome or trisomy 18. 95% of women that have a first trimester screen will have results in the normal range. The other 5% will be considered screen positive. While most women with a screen positive result will not have a baby with Down syndrome, most published reports indicate that 80 to 90% of fetuses with Down syndrome will be among the group with a screen positive result. Put another way, for every 10 fetuses with Down syndrome, 8 or 9 will have a screen positive result, while the first trimester screen will miss the other 1 or 2. If you have a screen positive result, your prenatal care provider will most likely refer you for genetic counseling to review the details of your results and discuss your options for additional testing, which include further ultrasound evaluation, CVS, or amniocentesis. More information about genetic counseling is available on the National Society of Genetic Counselors website at www.nsgc.org. In summary, prenatal care providers should offer testing for Down syndrome to all of their pregnant patients. After reviewing their options, some women choose to go directly to a definitive test like CVS or amniocentesis. Others decide to have first trimester screening to evaluate the chances for Down syndrome in their pregnancy before deciding about CVS and amniocentesis. Finally, some women choose not to have either diagnostic or screening tests for Down syndrome performed in their pregnancy. There is no right or wrong thing to do. Each couple makes the choice that is best for them. Since first trimester screening cannot detect all birth defects, your prenatal care provider might recommend that you have a follow-up ultrasound examination at 18 to 20 weeks of pregnancy, regardless of which of the above-mentioned options you choose. If you have questions, please discuss this presentation with your obstetrician, midwife, genetic counselor, or health provider. The Education Committee of the NTQR would like to thank Dr. Greg DeVore for his assistance in the production of this presentation, and Renee Shard, Certified Genetic Counselor, for her assistance with the script. For more information on credentialed providers, please visit the NTQR website at www.ntqr.org.